Greetings from Malawi here again. Thank you so much for all the positive feedback you've been giving us on our new format. Today we wanted to discuss about polio. As some of you are aware, Malawi has declared a public health emergency after discovering one case of polio. Now I know there's a lot of questions, so that's what we'll be addressing today around poliomyelitis. So I've heard a lot of questions, a lot of people asking, and I think everyone was wondering, like, it's just one case. How come it's an emergency? How come there's so much of this things happening around the country and even globally, BBC, Al Jazeera writing about this case. And it's important to understand because I think that will put you in context of understanding why we're having so much attention to this one child that was discovered. So actually, for Malawi, we've not had a case since 1992. And in fact, in Africa, we were declared, the whole continent was declared polio-free in 2020. So it's a big deal when suddenly we have one case. You can just imagine, I was telling somebody that it's the equivalent of discovering a baby dinosaur walking around in the streets. It's a huge deal because you'd have thought they were extinct, it no longer happened, and suddenly you see a baby dinosaur. So similar to that, it's the same thing that we've discovered one case, and that means that potentially there could be others. So this is an important reason why we're having so much attention to this issue, because although it's just one case, it's the first case in Africa in a long time, especially after being declared polio-free. It's the first case in Malawi, and that means that there's a lot of work that needs to happen in terms of understanding, are there more, is this just one out of many other cases, and so forth. So there's a lot of things that are going to be happening in country, both to ensure that we are definitely, that was just one case, and to understand everything that else that's going on. So just to also provide context on what we know about this case that was discovered in Malawi, we know that it was a 2.5-year-old girl discovered and diagnosed in Lilongwe because of her symptoms. So she obviously developed paralysis, which I'll discuss a little bit more about what are the symptoms and so forth. But when it comes to that, we do normal disease surveillance. That's whenever any child presents with any weakness of the limbs, the arms or legs, or any kind of form of like weakness and paralysis, there's usually a need to take a stool sample and test that. So they did that as a normal routine test, and then the result came back that it was actually polio, and it was polio that was derived, it was called wild polio virus. So that meant that this was a new case that hadn't been there before. You're probably also hearing that it's being called an imported case. That's because actually the strain that is discovered is exactly the same as the one that is found in Pakistan. The reason that's important to understand is just the same way that we've had different variants. For example, we recall that we've had like Omicron, which was first discovered in Botswana, or Botswana and South Africa, or at least they were the first ones to declare it. That means that it's similar, whatever the strain that we have of polio is similar to one that they find in Pakistan. Just to also put you in context that Africa region no longer had wild polio anymore, but two countries, Afghanistan and Pakistan, had polio still happening and cases still going on. So what we've discovered in Malawi is a case that is similar to the strain that they find in Pakistan. It doesn't mean that the person is from Pakistan, it just means that we've got a similar case, a strain. So we're trying to figure out, and that also explains to you why there's so much happening in terms of understanding, and a lot of work will be going around because we're trying to understand, is it something that came to Malawi? Was it brought back to Malawi? Is it something that is happening in the region and we're not picking it up? So all of that is reasons why we're seeing all of this happening. Again, just to understand that because this was a routine test that is done on any child that presents with this kind of paralysis, then we also have to do other follow-up. And the community, from what I understand, the community where this child came from has already been tested and they don't have any other cases. They're still continuing to follow up because what we do know is that very few people actually develop this very prominent sign of paralysis. Most people actually don't have any symptoms. So that also explains why there's so much happening in terms of understanding what's going on in the public health system, because maybe there's others who have it but aren't developing symptoms. So that's the context, a lot of background. Hopefully you now understand why this is happening, and there's a public health emergency, lots of global expertise coming on board, a lot of things that will be happening in terms of polio. But what is polio? And for those of us who've grown up in the last 20, 30 years, polio is probably something that we're not very conversant with, but it was a very, very common disease. And I think a lot of people, especially if you ask your sort of parents or grandparents, they will explain that it was very common for people to present with polio. And actually, in its full name, it's called poliomyelitis. Myelitis actually means infection of the nerve, sort of the covering of the nerves in your spinal cord and so forth. So myelitis is just an inflammation. And so polio is actually an infection that happens and it affects your nervous system. And because it affects your nervous system, a lot of things can happen. Normally, the symptoms that you would develop are, as I said, that majority of people, so data shows that 90% of people won't have any symptoms or will have very mild symptoms, but 1 in 200 of people will then develop what is known as either weakness of the arms or weakness of the legs, and that can also progress to paralysis. So they can actually become paralyzed. And so we do know, and I think a lot of us who've also grown up a little bit older, I used to live in Blantyre. We used to have MAP, which is Malawi Against Polio. It was a whole big program that was happening, and that was something that we all grew up with. So, it caused a lot of physical disabilities. A lot of people who are disabled, who are older, actually had polio. And this is something that there's no actual treatment for it. And that's why it's important to understand that it's also to understand why there's such a sort of focus on this issue. So we now understand there's a virus called polio, a type of virus causing polio. We understand some of the symptoms, which again will lead to this paralysis or weakness of the limbs. And sometimes because it affects the nervous system, that could also lead to death because it can also paralyze the muscles that help you breathe. That's why it can also be very dangerous. The second thing to understand is how is it spread? How is it moving around? So normally the polio virus affects your gut, and so it is passed around in your gut. So most of the time it actually is spread through touching infected feces, just the same thing like sort of it's fecal oral. So if, for example, a child had polio, it's in the stools, they don't wash their hands after, they touch a bowl, they touch something else, and then again, so that can be spread through other people. So it's people to people, but often using food, contaminated food or drinks. So again, that's an issue. Just to focus on that aspect of why things like hand washing are important. Sometimes people can also, like, for example, have it in their cough or sneeze, but the majority of ways that people will be getting polio is fecal oral and person to person because of contaminated food and water. So we've now understood what polio is, sort of what are the symptoms that we look out for. That, as I said, majority don't have any symptoms, but there's few that do could progress to paralysis or death. Then thinking around, okay, so now we understand what the disease is, who is at risk. So most of the time, what we do know, the people who are most at risk of getting severe disease, or polio at least, are those who have not received vaccination. Malawi has a great vaccination program, which has done a lot of work, and a lot of us will send our children to get vaccinated. We don't know, most of us don't even know that we're getting this vaccine, but it was one of the vaccines that we used to get. Long before we used to get the oral one, so there was always, I think, for parents who might not know that they're getting polio, but they will just get a drop in their mouth. Now they've switched that to an injection because also the oral one used to lead to vaccine-derived polio. It used to be like, because it was an inactive sort of a live virus, then sometimes the virus itself would lead to disease. So Malawi has switched to the injectable one, inactivated polio vaccine. And so for those ones, when we are taking our babies to the hospital, we know that they get an injection here, they get another one. One of those vaccines is actually also IPV that they get later. So let's think through this as, again, the preventive measures for preventing polio is vaccine. Again, if you have an outbreak, which we're not really thinking that we have one, or at least we don't think there's a lot of community spread of it, but vaccine is the most important thing. But then again, as I mentioned, hand washing, cleaning of food, and cleaning of your food and so forth is also an important factor. So that's something to also think about. So then, really thinking back to now we know what the disease is, what the symptoms are, how it's transmitted, how to prevent it, now reeling back to what's happening in Malawi right now. So we know that people who are at risk, again, are those who are not vaccinated, and also usually it's in children between the ages of 0 and 15. So that's why we will probably see a rise in campaigns and things to promote vaccination, because possibly there might be some children who are not getting the vaccine and who not received the vaccine. As I've mentioned, sort of I tried to bring it up as well, is that there isn't actually any treatment. So that's why the prevention is so important, because once a child is infected, there's not really much we can do except supportive treatment. If they have a fever, reduce the fever. If they, for example, if it affects their muscles, then they, you will try and help them breathe. But often, the paralysis is irreversible, so it doesn't turn back. And that's why we want to prevent this trajectory of infection from the get-go. So hopefully that's been helpful in understanding polio. Just to re-emphasize again, it does make sense that we're treating this as a public health emergency, because it's the first case in a very long time, and also just to make sure, because it's such a contagious disease, that we don't have any more cases, to also understand in our community if there were any cases that we're missing. And so hopefully we'll be hearing a lot more from our government and also all the authorities about polio and what's happening in Malawi as well as the region. Thank you so much, and continue to get credible news from credible sources like myself. Thank you.